For this week's segment on dentistry, we're going to talk about something that you probably don't like to get done. That would be a root canal. Joining us today is Dr. Bruce Goeringer from Goeringer Family Dentistry in Dallas. Dr. Goeringer, good to see you on the show.
Good to see you too, Dave.
Well, we know when we talk about root canals, it doesn't always have a positive connotation, but the issue here is that really it has to deal with some problem with the nerve in the tooth.
Generally, that's what it is, Dave. The nerve either dies because of just natural age, the aging process, or more frequently, it's a death because of infection from decay and just bacteria that's reached the inside of the tooth. And the nerve is infected, pressure builds up, and consequently you have a toothache, and that brings you to the dentist.
So when you go in for the root canal, how does the process work for maybe someone who hasn't had one done? Is it lengthy? Does it hurt?
Well, if you're in a lot of pain to begin with, you're going to have some pain for a while until it's under control. If you're not in any pain and there's just an exposure that's happened recently, we can anesthetize a tooth and you won't feel the root canal to any extent at all. As you told me before the broadcast, you had a root canal yourself and you didn't feel a thing. So more frequently than not, you don't feel the root canal as we're doing it because we anesthetize the tooth.
Yeah, I thought it was a pleasant surprise, actually, personally.
Yeah.
I heard so many horror stories, and then, you know, I had this numbing pain in my jaw for weeks, and when the root canal happened, it didn't hurt, and finally it was gone. So the great thing was, post-root canal, I mean, it sort of feels like, you know, you're pain-free again. There's no problems.
Yeah, that's generally the way it works. Once the root canal is completed, you restore the tooth. Generally, in a reasonably short period of time, you should have a crown on that tooth, and that tooth can last 20 or 30 years and be pain-free, and it's a tooth otherwise you would have been without for 20 or 30 years. Instead, now you have it for that amount of time.
Yeah, and it's good to have as many functioning teeth as possible. Dr. Goeringer, tell us a little bit more about your practice. Of course, you do things like root canals, and you're located up in the back mountains. Yeah,
we're located in Dallas. My office is along the Memorial Highway. We're just off the Memorial Highway. The phone number is area code 570-675-3646. And the website where we're located is www.drgoeringer.com.
All right, you can call Dr. Goeringer if you have any dental questions or would like to set up an appointment. As always, Dr. Bruce Goeringer from the Goeringer Family Dental Practice in the Back Mountain. Good to see you.
You too, Dave.